A very good morning, especially to our lecturer, Sir Andy. My name is Carlos Anak Colin Arpino. Me and my fellow group mates Jogeri Anazodet, Vicky Nelson, Mukhtaruddin, and Awang Muhammad Nurul are going to present our communicative English 3 presentation. So our topic for today's presentation is malaria cases in Malaysia. The first one is the explanation of malaria. Malaria is a disease caused by a parasite. The parasite is spread to humans through the bites of infected mosquitoes. People usually get malaria by being bitten by an infected female Anopheles mosquitoes because only Anopheles mosquitoes can transmit malaria and they must have been infected through a previous blood meal taken from an infected person. The malaria parasite life cycles involves two hosts where during a blood meal a malaria-infected female Anopheles mosquito inoculates sporozoites into the human host. People who have malaria usually feel sick with a high fever and shaking chills. While the disease is uncommon in temperate climates, malaria is still common in tropical countries such as Malaysia. The next slide is the details or background of malaria. The first one is who discovered malaria. In 1880, Dr. Alfonso Lebrun, a military doctor in France, Service de Santé des Armées, discovered the malaria at the military hospital in Constantine in Algeria. The second one is where is malaria most common. The highest transmission is found in Africa south of the Sahara and in parts of Oceania such as Papua New Guinea. Third but not least is what are the 3 stages of malaria. When the parasite infects, it attacks in 3 stages where it goes into the liver cell first, then enters blood cells and finally forms gametes that can be transmitted to mosquitoes. The third one is malaria cases in Sarawak. So at the left side we can see the map of Sarawak state, and that is the area of the cases. As you can see, we have Kuching, Syed Aman, Sarike, Sibu, Bintulu, Kapit, Miri, and Limbang. And as you can see on the right side, we have the pie graph of the cases in Sarawak itself. So as you can see, Kuching is the least cases in Sarawak with 0%. The second one is Limbang with 9%. The third one is Sri Aman with 12%, and the number 4 is held by 3 places. That is Sibu, Bintulu, Sarike with 14%. And then the 5th one is Kapit with a huge 17%, and the last but not least is Miri, which eventually has the highest malaria cases in Sarawak with 20%.
Affected country. There are 4 African countries accounted for just over half of all malaria deaths worldwide. Number 1 is Nigeria which is 31.9% dead. Number 2 is the Democratic Republic of Congo, which is 13.2%. Number 3 is United Republic of Tanzania, which is 4.1%. And lastly, Mozambique, 3.8%. What are the 5 types of malaria? Number 1 is Plasmodium falciparum. Number 2 is Plasmodium malaria. Number 3 is Plasmodium vivax. Number 4 is Plasmodium ovale. And lastly, number 5 is Plasmodium knowlesi. World data of malaria. Malaria was prevalent in many parts of the world that are free of malaria today. Historical distribution of malaria. Until 1900, 53% of the world and surface are affected. Malaria until 1975, 33% of the world and surface are affected.
Greeting to Sir Andy, my name is Igor Najonek. So next I'm going to present the causes of malaria. Malaria is an acute febrile illness caused by Plasmodium parasite which are spread to people through the bites of infected female Anopheles mosquitoes. There are 5 parasite species that cause malaria in humans, and 2 of these species, P. falciparum and P. vivax, pose the greatest threat. P. falciparum is the deadliest malaria parasite and the most prevalent on the African continent. P. vivax is the dominant malaria parasite in most countries outside of sub-Saharan Africa. So next is effect of malaria. Symptoms of malaria include fever and flu-like illness, including shaking, chills, headache, muscle ache, and tiredness. Nausea, vomiting, and diarrhea may also occur. Malaria may cause anemia and jaundice, yellow coloring of the skin and eyes, because of the loss of red blood cells. If not properly treated, the infection can become severe and may cause kidney failure, seizures, mental confusion, coma, and the most worst is death. So next, as you can see, this is the data of malaria cases in Malaysia. There are top 5 states that highly report cases of malaria. The first one is Sabah, number 2 is Sarawak, number 3 is Pahang, number 4 Johor, and number 5 is Perak. And the other states less compared to top 5 countries that I just mentioned. That's all.
Hi, my name is Mutaruddin. Now I want to share about the difference between malaria and dengue. To analyze the difference between dengue and malaria, for dengue is Aedes aegypti and it lives at tropical regions and active during the day. Malaria is Anopheles mosquito and it lives at a rural environment and active during the night. For the next slide is difference between malaria and dengue. The firstly is a time the mosquito active. For dengue is transmitted by the infected Aedes aegypti mosquito bite. It can also spread if another infective mosquito bite the affected person and spread it to other people. Aedes aegypti mosquito bite during the day of time. For malaria is transmitted through the bite of female Anopheles mosquito. Only the bite from the species mosquito can spread the fever in contract of dengue. The Anopheles mosquito is active during the night of the time. For the location for the dengue is Africa, the Americas, and Southeast Asia and Eastern Mediterranean. For the malaria is in Europe and Middle East. Cases of malaria are more found in a rural environment. Period time of getting sick. For dengue, the incubation period for dengue range from 3 to 14 days after being bitten by infected mosquito. For malaria, the onset of malaria fever is 10 to 15 days after being bitten by the mosquito. Symptom of mosquito. For dengue, there will sudden fever, headache, burning eyes, loss of appetite, bleeding gums, and rash on upper and lower limbs. For malaria, they will have a fever for a periodic time, chills, vomiting, dry cough, sweating, and faints. Lastly is diagnosis. Dengue is diagnosed through antigen test and antibody test. For malaria is diagnosed by microscopic test of the visual of the virus. That's all for me. Thank you.
My name is Vicky Nelson. I will continue with my part is a solution for malaria. How to prevent malaria from happening. Number 1 is apply mosquito repellent with DEET to exposed skin. Number 2, put a mosquito net on the bed. Number 3, put screen on the window and a door. Treat clothing, mosquito net, tent, sleeping bag, and other fabric with an insect repellent called permethrin. Number 5 is wear a long pant and long sleeve to cover your skin. After that is how to treat malaria. Number 1 is a healthy diet is important to speedy recovery. Number 2 is keep yourself hydrated. Number 3 is eat increased more protein. Number 4 is go to the hospital and take the medicine given. Now I will explain about malaria cases in Africa. The top 5 for malaria cases is in Mozambique. Number 4 is Burkina Faso. Number 3 is Uganda. Number 2 is Nigeria, and the most cases malaria in Africa is Democratic Republic of the Congo. The conclusion is malaria is an infectious disease that can kill a patient if not treated quickly and immediately. In addition, malaria should also be prevented from the beginning because a carrier mosquito can spread the virus to the different individual. That's all from our group. Thank you.